Dr. Shallenberger has been teaching ozone therapy to medical practitioners for over 20 years. He's the innovator of Prolozone. He has published 2 peer-reviewed papers on the use of ozone in clinical medicine. He is the founder of the Nevada Center of Alternative and Anti-Aging Medicine in Carson City, Nevada. And he's developed and pioneered the first method to measure mitochondrial efficiency in a clinical setting. I'm proud to introduce to you and pleased to welcome Dr. Shallenberger.
I want to first of all thank everybody for being here, and thank you all the organizing committee for inviting me back. It's always a pleasure to be with this organization. I was going to say that about 5 years ago I formed an organization called the American Academy of Ozone Therapy. I know many of you are members of that organization, and that experience has taught me a lot about these kinds of things, and I just want to congratulate all of you for just a fantastic organization. I can't believe what you guys do and the research that you publish and the good heart and the sincerity that this organization has. So it's just a real pleasure to be here with you today. And so you're doing such marvelous work out there that I want to make sure you stay healthy and stay alive so you can keep doing it for a long time. And that's sort of what this talk is going to be about. But first of all, I have to say that I do not have any financial interest of a product in my talk or with any companies offering grant monies for this continuing dental and medical education program. The topic that I'm going to be talking about is called preconditioning. I did want to mention, too, that the previous speaker, unbelievable lecture. I'm so glad I had an opportunity to hear that. I've been using neural therapy for years and years and years and years, and I learned some good stuff there. So, well, for all of you that do neural therapy, try this. Throw a little ozone in there when you're doing it. You're going to see some even nicer results. That said, we're going to talk about preconditioning. And so let's just go to this. I've been saying this for years. You know, we have a medical system that's oriented pretty much to treating things after they happen, but actually the best treatment for any disease is don't get it. Clearly. So that's what we're going to talk about. How can you make sure that you don't get a disease? Just a little interesting story. The other day I had a telephone consult with a dentist in Long Island, and boy, I'll tell you what, it was sobering. Here's a guy, he's 62 years old. He's a health nut, you know, and has been for decades. That's just the way he is. He is a cyclist. He's in tip-top shape. He eats right, he doesn't stress out, his life is happy, he's successful, blah, blah. Anything that you can think of that normally would drive a disease, he doesn't have that in his history. And yet he came up with bladder cancer 3 years ago. He's had several treatments for it. It keeps coming back. It's an aggressive bladder cancer. And just recently they told him he has bilateral kidney cancer. Now, that's probably not true. But because that would be the rarest thing that I can possibly imagine is bilateral kidney cancer. But you know, it's just I'm thinking of that. I'm talking to this man, and I'm thinking that's me. You know, I'm a guy that spends the last several decades of my life trying to work this out, trying to make sure I don't get a disease. I don't want to have to treat anything in me. And yet here he is. He comes down. So you know what? It's just that good old reminder: we're not invulnerable. So I want to thank Jerry Tennant for sending these slides to me, first of all. So let's just look at some of these slides, in case you thought you were invulnerable. So I think we're past the autism thing, but take a look at this. And now these particular slides are going to also look at glyphosate, which is the pesticide that is used in Roundup. That's the chemical that's used in Roundup. And I did want to just mention to you, in case you don't know it, to try and get the word out, the House of Representatives, U.S. House of Representatives, passed H.R. 1599 a few weeks ago. It's now going into the Senate. It was handily passed, not even close. Monsanto spent $21 million plus on this bill in the House of Representatives. What the bill basically says is two things. Number one, the states cannot enact legislation to force the producers of GMO foods to put that label on their foods. So you don't get to know if what you're eating is GMO. Secondly, and even more onerous, is the people that do produce foods that aren't GMO absolutely don't get to put a label on saying it's not GMO foods. So this is to guarantee you that you have no clue what you're eating. You have no clue what you're feeding your babies. You have no clue what you're feeding your children. This passed handily in the House of Representatives. It's on the way to the Senate. So if you have a mind to, call your local senator, talk to him about this, and try to educate him about things like glyphosate, because that's the stuff that is in Roundup. We have GMO foods. Why? Because GMO foods resist Roundup. So you've got your plants out there, you've got your field of plants, you've got weeds in them, you can spray the whole thing with Roundup. If it's a GMO food, it's a GMO corn, for example, or GMO soy, it'll thrive in that environment, not a problem. You'll just kill the weeds, and your produce would be really good. If it's not GMO, if it's organic normal plants, they'll get killed off by the Roundup. So when you eat a GMO food, you can be more or less guaranteed you're going to be getting a lot of glyphosate in that food. And you probably want to know about this because this is interesting. If you look at the incidence of autism, there's a lot of theories about what's causing autism. But if you look at the incidence of autism, this is what's happening from 1995 to the current time. Look at that, factor 6 or 7 increase in autism. And this red line superimposed shows when the introduction of glyphosates and GMO foods into the U.S. By the way, in case you didn't know, all European countries do not allow GMO foods. We're an exception. This one here is, once again, this is now looking at Alzheimer's. This is astounding. There's, if you look at this is the death rate from Alzheimer's, is 5. It goes up to 80 over the same time frame. Once again, what we have here is on the blue is the introduction of GMO soy and corn, and the red is the introduction of glyphosates at the same time. So you can see they parallel. So the whole reason for having a GMO crop is so you can dump glyphosate on it. That's the whole purpose. So Alzheimer's, deaths from Alzheimer's dramatically going up. Once again, this is diabetes, the same sort of thing. Now in this case, they've got a line here showing what the predicted at the same rate of increase, because we know diabetes has been increasing anyway, just due to the way we eat. But this would be the rate of increase if it's left to its normal thing. Something happened right around in here. Now I don't know if GMO is to blame for all of this, but this is pretty interesting because right around in here, GMO foods came in and glyphosate started to get dumped on those foods. We're talking soy and corn here. Almost everything that you give your child and your baby, unless you're paying attention to this, almost everything that you're feeding that infant is corn and soy based. And if it doesn't say organic on it, you can be pretty much for sure know that it's GMO. This is the deaths from Parkinson's. Once again, same old story. There's how it should have gone. This is what happened. So Parkinson's deaths up, Alzheimer's deaths up, deaths from diabetes. How about this one? This is anxiety and panic phobia. Look at the increase in this diagnosis since 1990, up from 150 to 400 in that time frame. Anxiety and phobias and panic attacks. And I can say you probably see the same thing. We do see it clinically in the office that really parallels this. This is inflammatory bowel disease. One of the things we know about GMO, this has been proven in a number of animal studies, very irritating to the gut. Once again, look at the incidence of inflammatory bowel disease. We just can't be sure that that's not going to be Frank Shallenberger up there. It's just we're under onslaught. Now, I don't know if it's got to do with glyphosate directly, if it has to do with all the flu vaccines that everybody's pushing, if it's the mercury in the environment, if it's all the drugs that people are taking. It's the stress, it's the electromagnetic stress, it's one of the 3,000 new chemicals that's introduced into the environment every year. I mean, I don't know if it's all that or if it's a combination of all that, but the point I want to drive home to you is we're just not invulnerable. Maybe we're a little bit invulnerable down in this time, but things are getting worse, and we're under an onslaught. I really do believe that. We're getting challenged, so that's the bad news. The good news is there's actually stuff we can do about it. So this is thyroid cancer. By the way, the autopsy studies now show if you're over the age of 60, that would be me, 100% of people have thyroid cancer. 100% of people. So all you over 60 group, you don't have to go get a thyroid scan. You don't have to think about it. You got it. Okay? This is the, it's not a problem though. You rarely get diagnosed with a problem, which is a whole nother topic. About the cancer deal, but let's leave that alone. But here's the incidence of thyroid cancer as it should be. Here's how it's played out. It's going up dramatically. And okay, so that sets the stage for an understanding that, what can we do besides what you already know? You already know you need to get to bed early, you need to get enough sleep, you need to get the amalgams out. You need to investigate, if you've heard me talk before, you need to have your mitochondria up running at a high level. You can investigate that with VO2 testing. You need to have good eating habits, presumably not with GMO foods. And we all know those kinds of things, but is there anything else that we can do? And yes, there is. There's this topic called preconditioning. Traditionally, ozone therapy has always been used to treat people who are already sick. So when I first saw it, I'm going to show you a bunch of studies here. When I first saw these studies, I thought, well, that's interesting. That's kind of quaint. They kind of really went right over my head. I did not see the implication there. Because I'm just so geared, as many people are, to, treat people when they get sick, and as long as they're eating correctly and whatever, I don't get too excited about it. But preconditioning is changing all that. Preconditioning refers to treating a patient with ozone therapy in a preventive fashion, actually before anything goes wrong. So if you're out there and you have nothing wrong with you, you're not on any pills, you feel great, you've got a good lifestyle habit, preconditioning talks about treating you right now, just in case something is going to happen to you. What could that something be? It could be that you need a surgery. You could have something pop up and you need a surgery. An accident can happen. So when you get the surgery, you might need a blood transfusion. You you're probably going to get some anesthesia. You're probably going to get dosed up with all kinds of drugs, not to mention the stress. And the previous speaker made a really good point to understand that these sorts of stresses are going to bring out everything else that's gone on in your body and all the interference fields that so far your body has been able to hold on to. That just might push you right over the edge. So you got to anticipate, well, that could happen. What about if you go to some place and you get a really bad infection, or you get a parasite? That could push you over there. This could happen to any of us. There's no guarantee it's not going to happen to you. So we just don't know. So ozone, is there something that you can do to make yourself a little bit more invulnerable? And that's what we're going to look at. Patients who have been preconditioned will be able to withstand all these kinds of stresses without becoming sick from them. And preconditioning, in my view, now it's changing the way I'm looking at things dramatically. And it should change the way we practice medicine forever. So when your patients come in, you can start thinking, okay, they're doing all the regular stuff. Now, what can we do to bump that up even better, since we're under an obvious assault with all these rather dramatic increases in diseases across the board? Okay, who needs it? Okay, obviously anybody who already has a disease. They're already at a more vulnerable state. So if you're on a medication, if you've been diagnosed with high blood pressure, if you've got diabetes, or whatever the thing is, if you're already there, well, obviously you're a real candidate for trying to improve your susceptibility level. Those who are at a greater risk for developing a particular disease. So let's say you have a strong family history of cardiovascular disease. You might want to think, well, what can I do about that versus the next person who doesn't have a strong family history or is not at risk. If you're a dentist and you're dealing with taking out mercury amalgams all day long, it could be an issue. And you might think, well, maybe I'm not invulnerable. Maybe I can start trying to do something to help me out. Anybody over the age of 50, you're vulnerable. So these are the kinds of people that could need this. What can it help you with? What sorts of things can beat on you? Even if you're doing all these healthy things, well, atherosclerosis. As you get older, your arteries are not getting cleaner, right? They're getting more gunked up. Now, that rate of gunking you can slow down, but let's face it, your arteries are going to get gunked up the older you are. There's all kinds of, we all hear this on the news all the time, new infectious agents, agents that we haven't seen before, new viruses, new strains of viruses. Happens all the time. We see viruses, or we see bacteria that are no longer susceptible to the antibiotics. We see people going into hospitals, respectable hospitals, and getting fatal infections from the instruments that are used in there. You could be that guy. You could be the guy that goes in for the cystoscopy just because your prostate's enlarged and get a fatal infection. You could be that guy. There's no guarantee, is there? You could be the greatest shape in the world. Like, I stopped riding my bike into work because it goes through the center of town and they cut out the bike lane. They put in another traffic lane. So I was thinking, what I'm going to be doing at some point, if I don't stop riding my bike down this road, is I'm going to be the healthiest dead guy on the side of the road. Because you don't know what's going to happen to you. So you don't want to be the healthiest dead guy who just got a fatal infection from the cystoscopy you just got. You just don't know what's going to happen to you. We mentioned the environmental toxicity things. We have no clue what they're doing to us. All we know is that the Congress wants to make sure we know less. But right now, we hardly even know what we're getting exposed to. Toxic medications. You know what the third leading cause of, you probably know this, the third leading cause of death in the United States is doctors. We kill them. We either kill them with surgery, we kill them with drugs. It's the third leading cause of death in this country. There's more and more medications out there. And some of these medications are new, especially the antibiotics, extremely toxic. It's not like the old days where you thought about antibiotics, they just, kind of mess up your friendly bacteria. Now they mess up your heart. They mess up your neurological system. You get seizures from taking the antibiotics. They rip your tendons off. So there are problems with this new generation of medications that we dish out all the time, maybe. You might find like you're like my friend in Long Island, the dentist I just talked to, who needs chemotherapy for his bladder. That chemotherapy might just push you right over the edge. We don't know what's in store for us. So I already mentioned the trauma issue. How about radiation? Fukushima. We have no idea what we're getting hit with radiation. We can try to avoid it all we want, but there's issues around it. Surgery, I mentioned surgery. You might need an emergency surgery. You might have an appendectomy, or these things are things that are not necessarily avoidable. Acute poisoning, you can get that. You can go to any restaurant, probably anywhere in the U.S., and you don't have to go to Mexico to get the bugs. Mexico's bringing them to you. So they're coming from all over the world. You could be that guy, okay? Is everybody happy now? Is this like a positive sort of talk? Well, I hope so, because we got an answer for you anyhow. Occult cancers. Occult cancers is a whole nother topic, and I don't think I've talked to this group on occult cancers, but you'd be surprised at the fact that probably everybody in this audience has 1 or 2 occult cancers. I mentioned to you that everybody over the age of 60, everybody, 100% has occult thyroid cancers, but occult cancers are cancers that are in your body. Your immune system's holding them in check. They're not doing anything. They're not going anywhere. Studies have shown that 40% of women over the age of 45 have an occult breast cancer, just to give you an idea. But we have them in there. As long as everything's okay, though, our immune system can hold them in check. It's when something happens, something pushes our buttons, so to speak. It could be an accident, it could be an infection, whatever, just don't know. That the immune system loses its grip and the occult cancer can come out and express itself. Stress from anywhere from electromagnetic energies to emotional stress and so forth and so on, and wondering what the House of Representatives is going to do next. Aging, here's a fact: the older you get, the less resistance you have to things. Period. Now you can slow that down, you can improve that, but that's what it is. As you get old enough, it's going to be more of an issue for you just doing that. And emergency medical conditions. So there's lots of issues that potentially could be in your future and you just don't know, and you don't always have control over these things. Okay, so preconditioning works through peroxides. Ozone works through peroxides. So we often talk about ozone did this, ozone did that, but the truth is, when you inject ozone, which is a gas, right? It's a gas. It's like oxygen. By the way, if anybody doesn't know about ozone, it's molecular oxygen 3. So the regular oxygen that we're breathing in the room air is 2 oxygen atoms. Ozone is made by passing O2, oxygen, through a chamber and out the other side. You get a collection of O3s that you reassemble as O3s. So O3 is ozone. It's a very reactive molecule. O2 is not reactive. I inject O2 in your body, nothing happens. It just sits there. I put O3 in your body, instantaneously it reacts with your body's tissues and forms these molecules called peroxides. So everything that goes on in the human body when we use ozone therapy is mediated by peroxides. Now that's kind of nice because ozone, when I put it into your body, is instantaneously gone within nanoseconds. It's immediately reactive. But these peroxides will sit there for up to weeks. So they continue to do their thing. And so if you give sequential ozone treatments, what you're doing is sequentially building up the peroxides. So what we see standard with ozone in many of the studies is you give somebody an ozone treatment and not much happens till you reach that magical sort of 14th treatment. And then all of a sudden, by then, the peroxides have been stepped up to the point that stuff actually starts to happen. Because these peroxides in your body are what make things go. It initiates the healing process. It prevents pain. It stimulates your digestive system, whatever. Peroxides are what make the whole thing tick. And so when we use ozone therapy, we're increasing those things. These are sorts of some of the things that are in the literature we know about. Cytokine stimulation, okay? Your body, your natural killer cells and other aspects of your white cells run around your body. This is really crazy. I don't know if you've thought about this. It's just nuts to me. Your NK cells run through your tissues, going up to all your cells on a regular basis, like little policemen. And they're going up to the cells and they're saying, are you a healthy cell? I want to see your ID. Or I want to know that you're a healthy cell. And if that cell can't come up with the proper ID, it's either infected with a virus or some other bacteria or a fungus or a mold or whatever. It's got a chemical in it that's killing it. Its mitochondria are off. It's mutated. Whatever's wrong with that cell, that NK cell instantaneously dumps cytokines on it that kill it. And then it moves on to the next cell. It's kind of nice. So these little soldiers are wandering through your body constantly. If you take NK cells and expose them to peroxides, you will upregulate their cytokine production by a factor of 200 to 300%. Now, what do you think happens to your NK cells as you get older? Do you think they make more cytokines? No, actually they don't, obviously. Nothing works better as you get older. So they make less cytokines. So this is kind of a good idea. You can maybe upregulate your cytokines, and that's what we in fact do. So that's one of the facts with ozone therapy. One of the reasons, by the way, that old people die of Legionnaire's disease, when's the last time you heard of a young person dying of Legionnaire's disease? It doesn't happen too often. Why do the old folks die of it? Because they don't have the cytokines. You cannot control an infection in a human being just with an antibiotic. You better have cytokines to back that antibiotic up. So what we see in ozone literature is that when you expose the animal, I'm going to show you a slide that shows this. When you expose the animal to a lethal infection and you give them an antibiotic, so many of them survive. At the same time, you expose them to ozone with the antibiotic, it works lots better. So that's cytokine stimulation. It increases the delivery of oxygen to the cells. Oxygen is obviously the most important nutrient you have. Just hold your breath if you don't believe me. And you will discover very quickly that it's the most important nutrient you can possibly take in. It increases the delivery of oxygen to all your cells. It increases the utilization of oxygen. So just because your cells are getting the oxygen doesn't mean they can use it. Maybe they don't have efficient mitochondrial efficiency so they can use that oxygen. So that's a whole nother deal, the ability to use the oxygen that you are getting. So ozone has two ways that it improves that. One, it gets more oxygen to the area. Two, it's going to help those cells increase the oxygen that they're already getting. Lots of stuff in the literature now, more and more on nitric oxide. Ozone, or the peroxides, I should say, that ozone induces. These peroxides induce the formation of nitric oxide by a factor 200 to 300%. Hemoxygenase 1, we'll talk a little bit about that, but this is a genetic factor that regulates cardiovascular disease and inflammation. It stimulates detoxification. As you get older, do you think you can detoxify better than you could when you were younger? No. Your ability to detoxify from things like glyphosate or whatever you're getting exposed to actually decreases. I'm going to show you animal experiments where it can increase if you have these peroxides in place. And finally, this is just huge. We know that the whole aging situation is determined by how well your body can control free radical or oxidant stress. There's nothing that you can use in medicine today, whether it's a vitamin C, IV drip, or whatever the heck it is. There's nothing that's anywhere near as powerful as what these peroxides do to your antioxidant system. So we'll be talking a little bit about that. So there's other things that we can talk about, but these are the major players that these peroxides do. Okay, now we'll get into some studies. So this one is looking at hemoxygenase 1 and NRF2. I think yesterday when the speakers presented the concept to you of NRF2. NRF2 is the genetic expression code for all your antioxidant systems. It's the major key player for all the antioxidant systems. Ozone stimulates NRF2. This is a paper by Bacci back from 2013. Endothelial cells, he treated this in vitro experiment. He treated endothelial cells with increasing doses of ozonated serum. What's in ozonated serum? These peroxides. So he's basically treating endothelial cells with peroxides at various strengths. So this is more peroxides, this is less peroxides. Okay? Both hemoxygenase 1 and NRF2 are activated, but they're not just activated, they're activated in a dose-dependent manner. That's pretty good, solid proof. The more you give of the peroxides, the more hemoxygenase you get. Pretty good, solid proof that that's what's actually doing it. They say these data provide a new insight on the mechanism responsible for the induction of hemoxygenase 1 expression by ozonated serum in the endothelium. So they're looking specifically at endothelium, which is the cells that cover the lining of all your circulation. So the endothelium is where the nitric oxide is made. It's where the hemoxygenase is made. It's where all your circulation delivers. It's that thing that gets worse as we get older. And what we're basically saying is you can turn that around with these peroxides. So on hemoxygenase 1, I do want to point out to you this study coming out of the Journal of the American College of Cardiology. So this is a real deal. Hemoxygenase 1 is the gene that encodes the enzyme that degrades heme into iron, carbon monoxide, and bilirubin. How many people out there knew that your body is actually making carbon monoxide? I didn't know that. I think that's kind of interesting. We make carbon monoxide. But so why do we do that? Why do we do something crazy like that? Well, carbon monoxide and or bilirubin have an anti-inflammatory effect on the body. Well, that's good. Inflammation is at the heart of chronic disease. They also have an anti-apoptotic effect. And that means your cells will last longer. They have an angiogenic effect, improving circulation, and they have cytoprotective functions, basically by stimulating antioxidant defenses. And what they say here is, thus the physiological induction of hemoxygenase 1, remember peroxides do that, okay, may be an adaptive and beneficial response to several possibly noxious stimuli out there, including heme itself, suggesting a potential autoprotective and autodefensive role in several pathophysiological states, including the #1 killer of people. Okay. We present some of the emerging evidence in support of the view that the induction of hemoxygenase 1 gene may be a new opportunity to target the pathophysiology of coronary vascular disease with therapeutic inflammations for management, and that's from ozonated peroxides. It's not from a drug. NRF2 is the master regulator of cytoprotection. Coming from this study here out of 210, these are the things that NRF2 does. It's a lot. It improves your detoxification. It regulates, once again, all the production of phase 2 enzymes in your liver. It's going to detox you from things like glyphosate. It enhances the stability and turnover of proteins, so your proteins will last longer. Reduces inflammation, key to protect you from all the various diseases you might be facing. Protects against neurodegeneration. We saw the slide that Alzheimer's and Parkinson's are both going up rather dramatically. Why is that? Not sure, but this can protect you against that, NRF2. NRF2, by the way, if you look, it's very species specific. The species that live the longest versus the species that live the shortest, who do you think has the more NRF2? It's the long-lived species. The shorter, the less NRF2 your species makes, the shorter lived you're going to be. It kills tumors. It promotes apoptosis in tumors and promotes longevity. That's a pretty good list of items for NRF2. Peroxides stimulate NRF2. This is a picture from one of Bacci's papers on the cytokines. So I mentioned cytokines before. This is what happens when you expose peroxides to various white cells. Basically every cytokine Bacci has ever studied. Look at all of them. Every single one of them. Some of you know some of these, like tumor-necrosis factor alpha, interferon gamma. This is the one that predominantly stimulates the NK cells that we just talked about. But all of these cytokines, every single one, is induced by ozonated peroxides. Okay, so now we're going to go into some of these preconditioning experiments, which when I first saw them, I said, that's interesting, but what has that got to do with us who are already healthy? I think you'll see what it has to do. This one's entitled The Effects of Ozone Oxidative Preconditioning on Nitric Oxide Generation and Cellular Redox Balance in a Rat Model of Hepatic Ischemia Reperfusion. So what they did is they took a group of rats and they subjected their livers to an injury. Okay? In several cases, the injury was a surgical injury. They just went in there and surgically removed chunks of the liver. Now the liver will regenerate itself, but if you remove a lot of it, you're going to kill a lot of animals. So what the whole idea behind the preconditioning thing is, you're going to take a group of animals, you're going to break them in half. This half over here gets about 3 weeks of ozone treatments. So the treatments are given rectally. So it's an insufflation into the rectum of ozone gas. When that gas gets in the rectum, it instantaneously turns into what? Peroxides. These peroxides last in the animal's body for 1, 2, maybe 3 weeks. And as they sequentially do this over a 3-week period, you're building up the peroxides to a pretty high level. At that point, you're subjecting all the animals, the ones that have been preconditioned and the ones that have not been, to some sort of stress. And that's what we're going to look at. In this case, the stress was an injury to their liver. This is pretty key because as we get older, liver function goes down as a function of age. And what is one of your major protectors against the toxicity in the environment, if not your liver? And so what they measured is nitrate to nitrite ratios. This is an index of nitric oxide production. They looked at superoxide, all the antioxidant enzymes, superoxide dismutase, catalase, glutathione, and they noticed that there was a correspondence between liver damage and the increase of nitric oxide, catalase. What is that? That's total hydroperoxides, glutathione, and basically they could see that there was a distinct correlation between the animals that have been pretreated with ozone in terms of all their cellular defenses were raised up versus the animals that won't. And then when they went and exposed the animals to the hepatic damage, the ozone preconditioning absolutely prevented any of the hepatic damage that the animals had. They all healed up. The quote here is, these results show that ozone protected against liver injury through mechanisms that promote a regulation of endogenous nitric oxide concentrations and maintenance of cellular redox balance. That's the method. But the key take home is this. The animals that were pre-treated with the ozone, none of them died. The animals that weren't, a bunch of them died. So that's liver. Now here's something that we can all relate to. This is now lethal infections. So they're going to take the efficiency of, these are antibiotics, in lethal peritonitis is enhanced after preconditioning in rats. Same kind of deal. It's rectal infusions of ozone gas to stimulate peroxides. What they did was they took some fecal material, injected it into the peritoneum, and induced a lethal peritonitis, 100% lethal peritonitis. Some of the animals were controlled, so they just let them go and they all died. Some of the other ones were given this antibiotic, and some of the control animals were given the antibiotic, and then the antibiotic was also given to they looked at just what the preconditioning did. Did that do it all by itself? And then what did the preconditioning do when it was combined with the antibiotic? So that's what the endpoints are. The preconditioning increased the number of blood leukocytes. So they went into the experiment, they went into the challenge of peritonitis with more leukocytes and granulocytes, and increased the survival rate of septic rats up to 33%. So all of the control rats died. The rats that had the preconditioning but no antibiotics, yes, 33% of them survived, so they didn't all die, and put them at a better advantage. Then, when they took the rats that had been pre-treated and combined and gave them the antibiotic, almost every single one of them lived. So this is a thing. If you're preconditioned with ozone and you get an infection and you actually have to take it, the odds are pretty good. It's like something like 33%. Odds are pretty good. You're going to just beat it yourself anyway, just with your own immune system. But if you can't and you require an antibiotic, the odds are extremely good that antibiotic is going to work. And then they say the preconditioning effect of O3O2 ozone preconditioning seems to support the biological effectiveness of that antibiotic by altering the immune system status before and during the onset of sepsis. One of the reasons we're seeing, this is my theory, but one of the reasons we're seeing all these lethal infections all the time, and the Legionnaires and all this stuff that just doesn't make sense to me, is because our immune systems are getting shot to heck. They're not what they ought to be, and they're not what they were 10, 15, 20 years ago. That's just a fact of life. That's why these infections are not necessarily the futility of the antibiotics as much as the antibiotics have to have an immune system to work with. You get a patient with an obviously faulty immune system like an AIDS patient, give them all the antibiotics in the world. They're going to die from that infection. The antibiotics aren't enough. You need to have your immune system working at the same time. And this preconditioning upregulates your immune system, makes you a little bit more invulnerable to these possibilities. So in this one, they're looking at carbon tetrachloride. So carbon tetrachloride is a chemical that's very highly toxic to the liver. So this would sort of mimic you and I going out into the world and at some point being exposed to a chemical challenge. So they exposed to the rats the carbon tetrachloride. Some of them be preconditioned, some of them hadn't. The preconditioning prevented the typical effects of carbon tetrachloride poisoning. They measured glycogen depletion and lactate overproduction. That just didn't happen in the preconditioned rats. The administration of carbon tetrachloride increased lipid peroxidation and uric acid levels and inhibited superoxide dismutase activity. All of that was prevented by preconditioning. And then finally, our results showed that the ozone treatment in our experimental conditions was able to prevent an anaerobic glycolysis and oxidative stress introduced by carbon tetrachloride. In other words, odds are pretty good if you're out there and you get exposed to some poison through no fault of your own, your body will be able to withstand it better. Here's another one. Ozone oxidative preconditioning inhibits inflammation and apoptosis in a model of renal ischemia. So now they're going in, they're doing sort of the same thing to your kidneys. So there's lots of things out there that can hurt your kidneys. Last year I saw 2 people go into renal failure from taking Advil or ibuprofen. It's not real common, but it happens. You don't know what you're sensitive to, by the way. The 3rd leading cause of death in this country is the medications we dish out, but we don't know who we're going to hit. You can get pharmacogenetic testing, which is starting to come up, and that's a pretty good little idea. And it'll tell you if that drug is likely to cause an adverse reaction into you. It'll tell you specifically if you're more than likely to get a renal failure from ibuprofen than the next guy. There's no guarantees. We just don't know. So anyhow, what they did is they preconditioned a group of rats. Half of them were preconditioned, the other weren't. They then subjected them to 45 minutes of renal ischemia, tied off their renal arteries, and then they saw what happened. So the renal function, inflammation, and apoptosis were compared 24 hours after this renal injury. Preconditioning improved the renal dysfunction and reduced the inflammation and apoptosis. In conclusion, preconditioning has potent anti-apoptotic and anti-inflammatory properties. So by preconditioning, you're going to make your body more invulnerable to the effects of inflammation and apoptosis, or cell death. This is an amazing study. In this case, they took rabbits. So they specifically looked at New Zealand white rabbits. These rabbits, if you infuse put them on a high-fat diet, for example, these rabbits, you put them on a high-fat diet, 100% of them will get severe atherosclerosis. They're very sensitive to that. So that's what they did. They preconditioned half the rabbits, and then they used this IV substance right here called lipofundin, 20%. Now, lipofundin is an IV, so they started the IV on the rabbits, and they gave them lipofundin, and that is going to induce, in these rabbits, atherosclerotic lesions 100% of the time. Okay? So they, once again, took the rabbits, divided them in 2 groups. One was preconditioned, the other ones weren't. And they did the IV on them for 8 days. And then they used hematoxylin staining and they did some pathological looks at their aortas, looking specifically for atherosclerosis. Preconditioning completely inhibited. These arteries are clean. You see the pictures in the article. It's absolutely astounding. They're clean. There's nothing on there. as opposed to the animals that, that didn't get the preconditioning. They were loaded with atherosclerotic lesions. That to me is amazing. That's astounding. As I get older, I know I'm getting gunked up, and I'm trying to do things to prevent that. But if I could stop my level of atherosclerosis right now by preconditioning, that sounds something pretty good to me, especially 10, 20 years from now when I'm, 80, 90 years old. Since our results reinforce the hypothesis that antioxidant effects induced by ozone, specifically the peroxides, in the context of atherosclerosis demonstrate the anti-atherogenic properties of the gas in the experimental conditions of this study. Once again, it's not really the gas itself, it's the peroxides that the gas induces. So we've looked at kidney injuries, we've looked at liver injuries, we've looked at poisonings, we've looked at infections, we've looked at trauma, and now we just saw atherosclerosis. Okay, what about chemotherapy? What about if you get cancer? In my clinic, I do treat a lot of patients with cancers. They're always the worst ones, are the ones that were sent home to die. Nothing's going to work. I do use chemo if I need to, but I always use it with ozone, and my results are tons better. I've had on occasion, they come in, they get their chemo, either from me or from the oncologist, whatever, and right after it, I always give them an ozone treatment, a systemic ozone treatment. Sometimes they miss. Sometimes for scheduling reasons or whatever, they just get the chemo and they don't get the ozone treatment, and they will come back to me and say, I'm not missing anymore. I don't want to do that anymore. I felt horrible, and it was a bad experience. This experiment is called ozone oxidative preconditioning prevents doxorubicin. Doxorubicin is a very commonly used chemotherapy agent that induces cardiac toxicity and can put you in heart failure. It's fairly common. It can put you in heart failure with standard doses that are used. So once again, they're using rats, and they're going to treat half the rats with preconditioning. What the statement is that cardiomyopathy is the main limitation of the anti-cancer drug doxorubicin, which causes oxidative stress and specifically kills cardiac cells. So they gave a bunch of rats doxorubicin, all got the same dose. Some were preconditioned, some weren't. The results showed that ozone therapy prevented left ventricular morphology, which was accompanied by a reduction of serum pro-brain natriuretic peptide levels. This is BNP. So BNP is a test we use. It's a blood test we use to determine the cardiac function of the heart. As the heart goes into heart failure, the BNP levels go up. Typically, your BNP level for a healthy one, you guys out there, is probably like less than 100. That would be typical, 60, 80, something like that. As you go into heart failure, it's going to be like 600, 700, something like that, maybe 1,000. So it's a marker for heart failure. So it reduced that. The cardioprotective effects of ozone oxidative preconditioning were associated with a significant increase of antioxidant enzymes, we've heard that before, and a reduction of lipid and protein oxidation. Ozone oxidative preconditioning prevents doxorubicin-induced dilated cardiomyopathy through an increase of antioxidant enzymes and a reduction of oxidized macromolecules. If you're ever told that you need chemotherapy, what you want to do is at least wait a month and do some preconditioning. And if you really are smart about it, start doing the preconditioning now, because you just don't know when something like that's going to be in your future. Here's another one. You get the idea that there are a lot of these. I'm only showing you a few of them. There's a lot of these that have been published over the last 5, 6 years. Protection by ozone preconditioning is mediated by the antioxidant system. This is another drug that we use all the time in cancer, cisplatin. Cisplatin kills kidneys. So acute renal failure is a dose-limiting factor of cisplatin chemo. Rats exposed to cisplatin with and without preconditioning. Ozone pretreatment prevented the increase in serum creatinine levels. The glutathione depletion and the inhibition of superoxide dismutase, once again the antioxidants, catalase, and glutathione peroxidase activities induced by cisplatin in the rat kidney. It protected the kidney against damage from the cisplatin, because when the kidney gets damaged, it can't make these enzymes. So it literally protected the kidney from damage. This is why it's so critical, if you're getting chemotherapy, to be getting systemic ozone treatments along with it. Also, the renal content of thiobarbituric acid, which is, this is a measurement of free radical damage, okay? The renal content of thiobarbituric acid reactive substances was decreased by ozone therapy. These protective effects were ozone therapy were dose dependent. We see dose dependence all the time on here. Basically intrarectal ozone, that's what they gave the rats, prevented effectively the renal antioxidant unbalance induced by the cisplatin treatments. Okay, so that's just a sampling of what you can do if you're preconditioning yourself with ozone. I've been, just so you know, I've been preconditioning myself with ozone ever since I figured this out, which is about like 4 or 5 months ago. So it's very easy to do. All you need is an ozone generator. A lot of you guys already have one anyway. So it's, let me highly recommend that you start doing this with yourself and start promoting the concept with your patients. I've got a book coming out in a couple of weeks. It's going to be a layperson's book on how to use their own home ozone generator system to protect themselves against things. And of course, one of the chapters is going to be on preconditioning. Okay, so anything that produces systemic peroxides. One of those things is exercise, intense aerobic exercise. But leaving that aside, this is major autohemotherapy. These are blood treatments. So you got to put a needle in the vein to do that. But you can go out and buy yourself an ozone sauna. There's remarkable stuff on sauna. Sauna induces peroxides. It's published data. We know that. So when the gas is applied to your skin, it produces the peroxides in your skin. They raise the systemic level of peroxides. All the things we have just been talking about can happen with an ozone sauna. A really quick, easy way to do it is just like what the animals did it. So a catheter goes into the rectum, roughly about good 4 or 5 inches into the rectum, just a small little catheter. And then very quickly you can inject 200 cc's of gas in. It only has to be in there for 30 seconds or so. It instantaneously forms peroxides. And those peroxides will build up over time. So if you were to just do this twice a week, you'd be preconditioning yourself. After about 14 treatments, you would get close to the invulnerable level. Can we do this with ozonated water? We're busy studying this. Well, how are we going to study that? It's simple. We give somebody ozonated water for a while and measure their serum peroxides. It's not been done before, but it's pretty easy to do. Ozonated oil, we've been using a lot of ozonated oil in the clinic. You take the ozonated oil, put it in a little capsule because it tastes horrible, and then you can take it orally that way. Once again, does it induce peroxides? To my knowledge, nobody's ever actually studied that, so we're going to look at that. But these are different ways that you could actually do some preconditioning on yourself. And that's it. It's a pretty quick, little easy presentation.